Good morning, everyone. I want to start by acknowledging a couple of other people. Dr. Judy Auerbach, who is a member of the committee, is in the audience. There may be others who are participating through our web telephone link. And I want to acknowledge Dr. Kimber Bogard, who's chair of the Board of Children, Youth, and Families, which was a co-sponsor of this evaluation. I also want to point out that there is a Lancet commentary that was written by Dr. Black that will be published today and is publicly available on the Lancet website. And an additional dissemination event for the report is planned for the first week of April this year. And last, there are copies of a report brief that give highlights of the full report. And the report brief is available on the table outside of this room. Okay, so you heard a little bit about the Institute of Medicine. For those of you who are not thoroughly familiar with it already, it is an independent nonprofit organization. It is a non-governmental organization, and as such helps to provide unbiased advice to decision makers and the public, in this case, of conducting the PEPFAR evaluation. Again, some of this you've heard already, but the PEPFAR program was initially begun in 2003. The first phase of it was really about rapid scale-up of treatment, care, and prevention. And then it was reauthorized in 2008 with a focus on expanding some of its targets, its service targets, but also transitioning to a more sustainable response in the partner countries. As part of the reauthorization, the IOM was asked to conduct this evaluation and was specifically tasked to look at a few things. Progress in meeting PEPFAR's targets for prevention, care, and treatment, to look at the impact of PEPFAR-supported programs on HIV prevention, care, and treatment programs, to look at the impact of PEPFAR on child health and welfare in the countries that it serves, and to evaluate PEPFAR's efforts to address gender-specific aspects of HIV/AIDS and to address supporting health systems. These are the members of the IOM committee, and I'll let you look at these at your leisure. So to go to the issue of how the committee undertook to plan for this evaluation, it's important to understand that this is PEPFAR is a very broad, multi-component and evolving program. And so planning for its evaluation also resulted in the need to take some time to design an evaluation. And so there was an initial committee that really spent a year and a half or so just thinking through what we would be able to evaluate and what the best methods for doing that would be. And then this committee took that and went forward with conducting the evaluation. So the process took almost 4 years. We were asked to look at PEPFAR since the beginning of PEPFAR, not just in the time since the most recent reauthorization. And one of the things that became really clear to us was that we were going to be able to assess what PEPFAR has contributed to the global response, although we weren't necessarily going to be able to attribute the outcome associated with each dollar that was spent on PEPFAR. We looked at the whole of the PEPFAR program. We did not evaluate specific countries, specific partners, specific agencies. We looked at the entirety of the PEPFAR funding portfolio. Okay, so the way in which we approached this was by what's called a mixed method analysis, in which we obtained data from a variety of sources. We had financial data from PEPFAR program itself and from other sources through the end of fiscal year 11. We had program monitoring indicators which were data that the PEPFAR program itself defined and had collected at various points in the program. We had those through FY10. We had clinical data from some of the early implementing partners, referred to as Track 1 partners, and these were available in 13 countries. We had epidemiological data from UNAIDS on prevalence of HIV and some on coverage of services. And then we did, particularly the staff working with us did a very large document review that involved looking at country reports and plans, other evaluations that were done on specific components of the PEPFAR program, et cetera. And last, the committee itself designed and conducted a large primary data collection, and this involved visits to 13 partner countries. These were strategically selected to represent a full range of the kinds of situations in which PEPFAR countries are operating. Members of the committee were present on each of the site visits and conducted almost 400 semi-structured interviews with a variety of stakeholders in each of the countries. In addition, we did interviews with 32 U.S. government or U.S. Stakeholders, as well as selected global partners. At the end of collecting all of this large amount of data, the committee spent a lot of time iteratively looking at the data. So we would come together, we would get one set of data, we would look at it, we would ask questions, we would say what we thought we could conclude, what other data we might look at to come to some conclusions. We would go away, the staff would collect that additional data for us or put it together in the new way that we had asked them to put it together. We would look at it again, we would look at the new data. And so there was a very iterative process of trying to pull all these data streams together so that we could present a coherent look at our evaluation findings. So that said, I will turn it over to Dr. Jen Cates to begin talking about what